Hi, and welcome to the second installation of VCU Health Chats Live. We are here with Dr. David Sifu. Thank you for joining us, Dr. Sifu.
You're welcome.
To talk about concussions. And Dr. Sifu is the chair of the Department of Physical Medicine and Rehabilitation at VCU School of Medicine. He is also the principal investigator on a $62 million grant that is studying concussions. So we'll be talking about that in a little bit. But just to start, let's just ask a really easy one. Can you tell us what are concussions?
Yeah, a concussion is the same term that as a mild traumatic brain injury. Concussion is sort of a lay term, but it is the term that's used by researchers as well. A concussion or a mild traumatic brain injury is an alteration in your thinking, in your sensorium, in your awareness that's caused by a significant traumatic force. So your head hits something, you move rapidly back and forth, such as in a car accident, you're thrown off to the side, such as playing football or some other sport, and your brain is moved so quickly that there's some stretching that occurs in some of the brain cells called the axons or the white matter. And that stretching causes your brain to have a temporary, very brief, it can be a second, it can be up to 30 minutes, but typically it's a couple seconds of just altered thinking and memory and awareness. Rarely, less than 5% of times, there's going to be a loss of consciousness like you see in TV shows or movies. Usually your bell's rung, you're a little confused, perhaps you're a little lightheaded or dizzy, and that event is the concussion. Right? That's what it is, and you don't have to hit your head. It can be just rapid motion back and forth. Like, let's say you're seatbelted in a car and your head just moves back and forth. Or even if you're playing football, your body can be hit and your head is thrown backward, but your head might not hit anything. You don't even have to fall to the ground. Just that rapid movement. The differences in the density of the white matter and the gray matter causes some difference from a physics standpoint in some movement, and just that rapid stretch, you know, as slow as 20 miles an hour, 15 miles an hour can cause that if your body isn't prepared for that and your brain takes the brunt of that.
Okay, so you said you mentioned car accidents, sports. What are some of the most common ways that people get concussions?
Yeah, I mean, there's 2 or 3 high risk groups. The main risk group that we're talking about mostly today are those that are, let's say, 12 to 24 years old, or say. So the teenagers to young adults. You know, their highest risk is going to be first motor vehicle collisions, which is always the answer, whether they're passengers or young drivers. Number 2 is going to be sports, which we're talking about today as well. And the sports that tend to be at high risk are, you know, the high contact, high movement sports such as football, hockey, soccer, boxing, MMA are off the charts because the goal of those things is to cause concussions to win. But so sports, trauma of other types, so, you know, someone attacking you or you're being hit by a falling object, if you're a civilian, if you're in war, you know, IEDs or other kind of things hitting you that shouldn't be out there. But certainly in this group, it's motor vehicle collisions and sports. In the other high-risk group, which is older adults, those over age 65, it's just simple falls, okay, because of the fragility of the brain. And then there's a third group, which is children less than 5, and abuse, being shaken, is the most common cause in that group.
Would shaken baby syndrome be a concussion?
People don't use that term anymore, but yeah, that was how it came about. Yeah,
right.
If you move the head rapidly enough, you're going to cause a concussion. In adults, you know, unless there's a 12-foot tall person to shake them, that's not going to occur, which is why we use machines called cars to do that. But in kids, just, you know, less than 5, just shaking the child's head back and forth because you're angry or because you're not thinking about it, you toss the child because you've got a fit of anger. In children less than 5, that alone can cause a traumatic brain injury, usually a mild one. You know, in any of these things, if the acceleration is hard enough, the force is high enough, you go from a mild to a moderate, where there's actual bleeding in the head that you can see on X-ray, CT scans, MRIs. In concussions, 98% of the time or more, there's really nothing on traditional X-rays or imaging, standard MRIs, CT scans. In more advanced research stuff, we can find it often, but in things that you'll get in the hospital, rarely are we seeing changes acutely.
Okay, and yeah, you did mention the military concussions, and that's something that you study a lot with your grant, the $62 million grant, and we'll talk about that in a little bit. Just to remind you all watching, please comment with your questions below and we'll try to get to them in addition to the questions we have here. But please send in your questions about concussions so Dr. Sifu can answer them. So you talked about MRIs. What are the best ways to diagnose a concussion?
Yeah, the gold standard way of diagnosing a concussion is to ask the person what happened at the scene. Obviously, if you're at the scene or you've witnessed it, you can provide added information. I saw him or her get hit. They were in a car accident. They were on the field and they got knocked down. They had a period of confusion for a couple seconds or a little bit longer, and then they started to come out. Or you ask the patient, do you recall being hit? Typically, they'll remember the events of around the time of the hit or the car accident or the explosion, but the actual contact themselves, they typically cannot recall, or they only recall it because they figured out, well, I'm playing football, I'm down on my butt, I must have gotten hit, but they don't remember the actual contact. So there's a period of amnesia that's occurring where they don't recall what happened just before and often just afterwards. The other things that are used to diagnose it or support the diagnosis, are going to be some simple questions about memory and attention, orientation. Where are you now? What day is it? What are you doing here? What's your home address? So you ask some simple thinking skills. You can also do some simple balance testing at the scene to see how a person is doing. Balance can be standing, sitting balance can be. It can be how well you use finger to nose and how you use coordination. Later on, in addition to the history again, as I mentioned, there may be some imaging that could be positive. Usually it's not, but some MRI scans can be positive. We usually will only do that for research issues because it doesn't change how you treat a person with concussion, and that's why we're doing testing. And we've already made the diagnosis by understanding what happened to them, asking them the question, making sure there's nothing worse going on with them, making sure they didn't have a more severe brain injury, making sure they're coming out of this confusion within seconds or minutes, making sure they're not having visual changes in their feeling, sensation, weakness. None of those things should last more than a couple seconds to minutes. If they do, then we have concerns that maybe something more significant occurring. You're checking blood pressure, pulse. You're checking their ability to, as I said, have an increased awareness, go back to normal. Again, usually happens within seconds to minutes. When it persists, that's when we do a more thorough evaluation. And more comprehensive, but really the evaluation is based on good old school history and physical, simple things that any competent clinician with some training can get to that level.
So those questions that you ask, is that immediately after the concussion was sustained?
Yeah, what we'll do is certainly, if we can, if they come into the emergency room hours later, you're not doing that, but certainly if you're on the field, if you're in the battlefield or the sports field, or you're at the scene of an accident, you're asking them at the time, as soon as you can thereafter, and then you're going to do that serially. You might want to repeat that over time to see if they're getting back to normal.
Yeah.
If they start off normal and they really get it all right, then you want to just repeat that to make sure they're not having any decline. Right. Because a decline would indicate something else is going on.
Oh, okay.
If a concussion doesn't get worse over time, concussions will improve over time, particularly the neurologic abnormalities, the thinking and the confusion issues. Some folks may get a headache over time, or some dizziness may worsen as they start to get up and move about, but the actual ability to think and be aware will not worsen over time, and if it does, we have to look at other factors.
Speaking of that, what are those long-term effects of concussions?
Yeah, what we know is, and this is part of what we're studying, and some of our partners across the country are studying is what we know now is that the vast majority of individuals, 85%, should have returned to normalcy by 2 weeks. All right, 2 weeks or less. All right, again, we're going to be very conservative with this 2 weeks even. Those that have persistent symptoms at 3 months, what used to be called post-concussive syndrome, it's now really just called persistent symptoms after concussion, is about 15 to 30% at most. All right, now again, I think it's much less because the people that come to see you and people that come to hospitals are those that have the symptoms. Less than half of people that have a concussion will ever see a healthcare provider. So we tend to see, both in hospitals and specialist office, we tend to see those that have problems, all right? So again, 85% are doing great at 2 weeks, probably more if we looked at those that didn't come to the doctor. You know, by 3 months, maybe that 15% is still staying around, maybe it's even less. By 1 year, less than 5% are having any long-term difficulties. Now that's the standard teaching. That's what the data we know. There's increasing concern and maybe some research that's supporting that there are subsets of folks that may have more symptoms, they may have symptoms longer, and some that even will have some long-term sequelae where their brain may worsen over time, 5 years, 15 years, 20 years. The folks that are getting what we see in movies and on TV shows and somewhat in labs of what's called chronic traumatic encephalopathy or dementia of TBIs. Right, so that's the concern, that there are pockets, you know, folks that are in military combat, people that are playing a lot of sports and getting lots and lots of concussions, and those that have the combination of concussions plus overlying stressors, PTSD, chronic pain, depression, anxiety issues. You know, folks that are not just being taxed by one relatively mild injury, but are getting a mild injury plus physical stressors, emotional stressors, or those that are getting several concussions in the course of weeks or months that aren't being assessed or treated. I mean, that's the issue. The issue isn't the mild injury that's occurring once or twice in your career. It's folks that are getting multiple concussions in a series of days or weeks or months, and that really aren't being treated and actively managed. They're either being told to go to a dark room and hopefully it gets better, or they're not being diagnosed at all, or they're being put right back into the fight or the game, all right? And that's the problem, I believe. It isn't the actual injury, because you know, you can hit your knuckle once and it hurts a little bit and it gets better. But if you hit your knuckle 5 times over the course of that day, all right, and the next day, and each time you just kind of say, well, it's okay. After a while, you're going to have some swollen knuckles. Something as simple as a joint of your wrist or your knee, all right, or your shoulder. Repeated injuries over time. But then if you think about it, people that have jobs where they repeatedly injure their knuckles or their shoulders, or in this case their head, those folks over time will develop arthritis or changes of their hand. Same thing with the brain. Unless we're doing something to prevent these multiples or to treat them in between, those are going to add up. And that's what we're seeing.
Right. So what you're saying is like that high school football player who got one concussion, not probably so much to worry about, but the soldiers and the football players who are sustaining multiple concussions over a course of years that aren't being treated, that's what you're concerned with.
Yes, you know, and to the folks who are watching this, you know, clearly if you're a mom or your dad or a loved one, whatever gets one, you're very concerned. I'm like, what your concern should be is, okay, this happened. It's part of the game. It's part of military. It's part of the misfortune of being in a car accident. What am I doing to actively treat that so that that person gets as to a higher level as they can quickly? And we can talk about that. What are they doing to keep the rest of their body in great shape so that if they do get a second one, or if they don't have perfect recovery from this right away, the rest of their body can be in great shape to support that brain? And as you just indicated, what do we do to prevent the multiple ones over time? Yeah. You know, how are we going to stop these, you know, football players from getting 10 more? What can we do? Or military or soldiers or folks that are at high risk. How do we prevent people that have multiple motor vehicle collisions? How do we prevent that? You know, prevention is very hard, but there are certain things that can be done. And one of the best ways to prevent it is make sure we had total recovery from the first one, and the person was ready to go back to driving, was ready to go back to play sports or be in the military. I mean, and that's a lot of the focus of what our research is here at VCU, and it's part of the military and the VA, the program I'm running, is, you know, these things are going to occur. What are we doing to optimize the assessment, to optimize the short-term recovery and the long-term? And then what about the outliers that no matter what we do, they seem to have difficulties? What innovative things can we do to prevent that from getting worse and to help them get back some of their function in their life?
Yeah. So let's talk about that for those people that are watching. If they know someone who just got a concussion, what are their step 1, step 2, step 3 that they should be doing?
Yeah, all right. So step 1 is always awareness that, you know what, you were playing football even at a pee-wee level, or you were in a car accident, or you had some other, you know, you fell off a ladder, and you were a little bit woozy for a couple seconds, you know, you shook it off, you know, and you said, I'm okay. You know, you probably are going to be okay. and I feel very comfortable telling you that even through the iPhone, all right? But get evaluated. You have to go to the emergency room, all right? You do if you're not responding well. Go see your primary care physician.
Come to VCU.
Yes, you should. Go to VCU. Come see me. Come see our team. Yes. Go to a primary care doc, an urgent care. Go to an ER if you have to because of the medical urgency. Get evaluated, all right? And when you're evaluated, this would never happen at VCU, but when you're evaluated, if they don't get that you had a concussion, just say, hey, you know what? I think I may have had a concussion. Can I please be evaluated for that? And I'm not just being facetious. Very often, emergency departments, urgent care, are more concerned about the bump on your head or the twist to your knee because you look pretty good and you're talking normally and you can answer a lot of questions. Mike, you probably are going to be fine, but the initial assessment is vital, all right? And then getting a sheet of paper from them that says, stay up all night and drink coffee, that's never the right answer, all right? A sheet of paper that says, you're probably going to be okay, sit in a dark room, don't go to school until you feel well, that's not right either. What the sheet of paper should say, what the professional should tell you is, you've sustained an injury to your brain, it's mild in nature, the chance of your recovery is 98%. All right, what we need to do over the next several days is get you back into your normal life as quickly as possible. If you have some symptoms, most commonly headache, some dizziness, perhaps some confusion, in some smaller cases, some frustration, irritability, if you have those, that's a normal part of a concussion. Those are usually self-limited. We'll get well within a couple days, perhaps a little bit longer. We can treat those things. All right, if it's a headache, we can take something as simple as Tylenol. If you've got neck pain or if you have dizziness, often a return to activity will actually help those things. If you need to see a physical therapist like the wonderful ones we have at VCU, that would be terrific. If in doubt, go see a professional, see a specialist. Insist you see the brain injury specialist at VCU. You see the physical therapist. All right, do not just say, well, they don't know what's wrong with me. I know what's wrong with you, okay? You don't need 12 CT scans. You don't even need a CT scan, all right? What you need is to be evaluated by someone who's going to get you remobilized, all right? You need to go back to school the next day.
The next day.
The next day. You need to return to physical activity the next day, not contact. I don't want you playing football the next day. I don't want you playing some other sport, that you're at risk for injuring yourself, but I want you to get physically active as much as your body will allow you. That may mean you can't scrimmage. That may mean you just need to go on a treadmill, or you may need to do some simple stretching, or you may need to do some simple workouts that your team is doing, all right? Alert the trainer. If you need to get a wonderful note from your doctor, get that note. If the doctor says, well, we're going to sit you out for 3 to 5 days because I have no idea, don't listen to that. Get reactivated under the care of a clinician who's going to say, we're going to expect some headaches, a little bit of dizziness, but we know, because there's research to support this, that physical activity early on has been shown to have a better long-term outcome than sitting at home.
Right.
3 to 5 days of rest has been shown to be harmful after concussion. 1 to 2 days is the standard. So I'm saying, take the rest of the day you're injured off and get on the school bus the next day. If the school bus makes you dizzy or it's too loud there, have your family member drive you, all right? But get to the school, all right? If you want to opt out of a test for a couple days, fine. You have my blessing. It's just a test. But get into that school. Re-socialize. That's how the brain recovers. It does not recover by playing video games or by staying at home or by being in a dark room. That's not normal for the brain. So get back to physical activity.
Yeah.
Right? A return to contact sport or to the actual sport should occur with clearance by the medical professional who would say, yes, they can test you to see if you can scrimmage well. And if you can do that okay, if you're able to have good coordination, you know the drills, and you're doing okay, even if you have a little bit of a headache, even if you don't feel absolutely perfect, but you're able to do all the skills, that's the kind of person I'd say, let's get you back into play. All right, let's really do that.
Great. If you're just joining us, this is a VCU Health Chat with Dr. David Sifu. He's the chair of the Department of Physical Medicine and Rehabilitation here at VCU School of Medicine, and we are talking about concussions. Please comment with your questions below, and I think we've gotten a few.
Wonderful.
So we're gonna go ahead with those.
I'm gonna pass them over.
All right. So first question. I think we might have already talked about this, but it says, can you discuss medical mismanagement of concussions?
Yeah, and again, I don't want mismanagement. Concussions is an evolving area. All right. Now, just as 20 years ago, it was appropriate after a heart attack to be at bed rest for 6 weeks, or after a stroke to stay in bed for a week, or even after a blood clot in your leg to be immobilized for a week. We believe that was the answer for concussions. I'm not sure why we believe that, because rest has never actually helped anything. But let's give folks a pass. Let's say it's a tough area and it's a little controversial, But this is what I've been doing for 25 years. VCU is the nation's leader in studying concussions. We've got 30 other universities that we partner with. All right, don't over-test. The test is ask them the questions. What happened to you? Can you describe it? How are you doing now? What symptoms are you having? If you're having symptoms, do the simplest treatment possible. If they have a little headache, try some Tylenol. If you need to, refer them for a wonderful physical therapist. If they're dizzy, physical therapy 101. Patching your eye doesn't help dizziness. Laying in a dark room helps you sleep, not the goal of concussion care. We want to mobilize, all right? If an athletic trainer can provide that care, that's wonderful, all right? If you have some subtle memory problems, get to school, get to work, get back into your groove, all right? When I sit at home or on vacation, I have tons of memory problems. When I'm at work, when I'm doing this interview, my memory's jumping, all right? I'm getting my brain working. That's how the brain works, okay? If you're not sleeping well, there are some simple non-medication treatments. So talk to your family doctor, your pediatrician, talk to your specialist, correct them, bring them information, question it. This is a relationship you're developing in terms of clinical care, all right? Nobody's right or wrong. What's best for you as the patient, all right? But mobilize is very important, all right? And, again, I'm happy to modify based on each individual patient what they need, but in general, pushing a person to do more has always resulted in a positive outcome, all right? Even if it's a 7-year-old or a 70-year-old, all right? That's the full range of folks, or 2 to 2,000, whatever the number is you want to use. Really get folks up and active and do symptom treatment. We have evidence-based protocols, clinical practice guidelines that support these, that talk about how to do this and to talk about early and rapid mobilization.
Great, and this might be a good time to mention that these VCU Health Chats are educational discussions, so we do appreciate Dr. Sifu lending his expert advice, but you should consult with your physician prior to making any medical decisions. Don't rely on this chat for that. Okay, so now on to the next question we got. It says, can you chat about the autonomy debate surrounding informed consent and football players regarding head injury risk?
Yeah, yes. So it's not just football players. Certainly, it could be in the military as well. It could be any situation where the person playing the sport or doing the job or somehow engaged in the activity. There's 2 layers to the question. One layer is, well, does a person immediately after an injury, a brain injury, a concussion, do they even have the awareness to give their consent to return to play? All right, are they in a at-risk situation? Who should make that decision for them? And the answer is, while 99% of folks after a concussion within several minutes is going to be fully able to make that decision, in terms of cognition, but because they're in a situation where I want to play football, I want to seem masculine or feminine, but whatever you want to seem. I want to seem like I can go back and play or fight, or I'm okay to drive, I need to get home, right? Because of those pressures, there should be rules, and there are rules. That's the role of the trainer, the physician, and ultimately the coach. Now, there have been certainly some abuses of that, and I'm a very strong believer that let's not leave these decisions in the hands of anyone. Let's say if a person's had a concussion, and you've all heard simply how to diagnose that. If a person's had a concussion, they can no longer play for the next 24 hours until they're evaluated by somebody. That way, even folks that had an injury that was very close to a concussion, we call there are some there are some potential concussive events, which is a little bit silly, but folks that have had injuries which are just below the threshold, which again, I don't understand exactly how to come up with that, but that verbiage is being used. But even those people will be taken off the plate. So I completely agree. Nobody should make the decision. The decision should be, you're on the field, you had an alteration in consciousness, there was you self reported that, a trainer reported it, the referee reported it, anybody reported it, you're gone. You ain't going back. Because there's no decision I would ever make in the sideline that would say that person should go back. All right, and you do need a little bit of time because the coach is going to have some divided interests. The person who's in charge of that platoon may say, we got to go back and finish the fight. All right, and they may have to, but it's ideal for the person to not do that. So it is a challenge, but I think we need some black and white. And sadly, as we can see from some of the recent things that have occurred in professional sports, that's not really what's happening. And it's amazing how around playoff times things change. So I think we just need black and white rules, and coaches are not, it's not putting the coach in the right position. And even often the sideline physician or trainer, they may be under pressure. So it really just needs to be black and white. Just sit down, and enough of these high neck sprains. Like high neck sprains like a brain injury. So I think neck injuries should also be seated because that's the euphemism that's being used for concussions now. He's got a sprained neck. I'm like, the reason the neck sprain is to move really rapidly back and forth or to the side, and there's this like lump of spine at the end of it. It's called the brain that also moved, and that was injured.
Right. Okay. Looks like we might have some more questions from that.
We're stimulating them. I like it. Bring it on.
All right.
Very high tech.
Yeah, this is.
Chalkboard. Yes.
We have here. I think we might have talked about this a little bit before, but what are the results if concussions aren't diagnosed properly?
Yeah. Nobody knows exactly. All right, because that's what we're trying to study. And if you read the book League of Denial in the NFL, the answer is you get dementia. It's probably not the answer for 99.9% of the world because we've had concussions for over 3 million years as evidence in prehistoric skulls of Neanderthals and other early man, that there were brain injuries that they recovered from and they lived for years and years after. So there weren't a bunch of demented Neanderthals walking around. Just as we don't have millions of demented folks who play high school football, all right? What the results can be is if you're underdiagnosed, meaning you don't go to see a professional and you don't even think about it, or you're just as badly, you're undertreated, because even if you don't diagnose it, but you do reactivate yourself and go to school and re-perform activities with some control so you're not being injured again, that's a form of treatment, all right? But if that's not done, you have an elevated risk of having persistent symptoms, all right? And if you have persistent symptoms and then repeated concussions, you have an elevated risk of having worsened symptoms and then functional decline. You can't actually do things in your life. And then in a worst case scenario, very small percent, something like in the 0.00 percentage, you're going to go on to dementia, all right? And those are the folks that are getting hundreds and hundreds, if not thousands of concussions. Professional athletes have thousands of concussions. So 1 or 2 is terrible. 3 or 4 is probably worse. How close they occurred to each other, what you did right afterwards, how you're taking care of the rest of your body. Are you early activating and getting back to it? Are you healing the brain? Those are key factors, but certainly the number is important and how close they occurred. So, if the sport is causing multiple concussions in you, or if you're driving your car in such a way you're getting multiple accidents and concussions, we need to rethink this.
Yeah.
Just as the recent NASCAR driver, stopped driving, was probably gonna stop driving. It's like, stop driving your NASCAR. You've had 6 concussions and you almost died in the last one. You will likely have problems long term because it's been 3 months and you're still having problems. So the key is, early treatment, early diagnosis, but also remove yourself from the sport or the activity because, there's a reason why you had the last 20 concussions.
So like we said before, it's those people that have the long-standing concussions that you need to worry about for long-term effects, but the people get 1 or 2, probably not
Yeah, no, if you have one or two, worry more about your waistline and about going to fast food places. Yeah. I mean, don't worry about, worrying is actually the worst thing in the world for concussion. Right?
Yeah.
You know, be mindful, meditate, which is a great treatment. You know, get your brain to a point where it's healing, and then but keep your body active.
Yeah.
You know, and socially go, stay in school, read books, no more video gaming, no more Pokemon running around looking for weird gold things, all right? Read books. That's not active. It is active. You're right. It is. But you know, come on. They're running around like this. I bet they actually cause concussion as they're running with the
running into things. Yeah.
So.
All right. You said something about worrying earlier. This has something to do with that. Again, we are talking generally. We're not diagnosing anything, but we have a question here. It says, "Can you comment about the risk of TBI after?" I don't know what this is. MVA?
Motor vehicle accident. Or
motor vehicle accident, and someone with anxiety and other stressors as contributors to recovery.
Yeah, you know, my key research is in the military, but we also studied issues with motor vehicle collisions in civilians as well, and looked at some factors. But 3/4 of veterans who have had mild traumatic brain injuries from the recent conflicts, 3/4 also had post-traumatic stress disorder. All right, up to 90% had either post-traumatic stress disorder or depression. So we've got a brain that's been concussed at least one time. You know, often up to four times is what we saw in some of the folks that were in the conflicts. But on top of that, that brain, which is trying to heal, is constantly being bombarded because it's having stress. All right, the stress could be from the event that caused the brain injury, or it could be from some other external event, or they could be having anxiety over their life if it's a motor vehicle accident, or they're worried about how they're going to pay their finances or insurance, or they've got depression because they have some underlying depression, or they have some new depression situationally related to the event or their life circumstances, or they've got chronic neck pain or headache. That chronicity, that ongoing pressure on the brain, that is making the recovery slower, more difficult, and probably going to result long-term in some more compound difficulties. So I think over time we're going to see lower rate of total recovery. We're going to see higher incidence of chronic symptoms and disability, and again, in a very small percent, a higher incidence of neurodegeneration over time. All right, so higher risk of dementia related to the multiple brain injuries, the overlying stressors, physical, emotional, etc. You know, and again, not keeping your body healthy. This is one big machine here. It all needs to work well. The emotional, the physical, as well as the cardiovascular is very important. So as I said earlier, meditation, mindfulness, finding a way to improve some of the stresses in your life. And there are scientifically proven, evidence-based ways of improving post-traumatic stress disorder, depression, general anxiety disorder. All right, you know, while it's fine if you believe in herbal treatments and alternative care, that's fantastic if that works for you, but also consider some of the more integrative approaches where you're using both a traditional medical approach as well as some of these alternative factors, because really the brain's fairly complex. It's got like 50,000 million things going on at the same time. I'm pretty sure one pill isn't going to treat it, nor one deep breathing session. So I think we need to do these things all together, all the things we've talked about, under the supervision of a VCU healthcare professional. Not me, a healthcare professional, but not on this internet chat, but under the care. That's going to be your chance of success. Multifactorial approaches, multimodal, very important.
So that's interesting. I didn't realize that things like PTSD, anxiety, depression, that can slow down the recovery process.
Yeah, it can not only slow it down, it can also make it more challenging to treat. So, you know, you can still use the same remedies, whether you're trying to treat the PTSD or the concussion symptoms, which often it's the same treatment, but you'll often need to provide more extended sessions, more long-term sessions. You need to let the individual, the patient know that, you know, it may be a little bit up and down. We may see some improvement, then some worsening, but we're trying to just get the curve to go in the right direction of improvement, but it may take longer. We may need to be clever and come up with some additional strategies, all right? And you know what? That's why you see a specialist. This is what we do for a living. We see nothing but people that have challenges like this. All right, now even those folks do need to be evaluated to see if we've truly gotten all the aspects better. And, you know, because some people may want to man or woman up and say, well, I'm fine, you know, the other guys are much worse. I'm like, yeah, but there's still a little irritability there under the surface. They may still have a low degree of headache, and over time that will build likely. And so we just need to kind of crush that, really attack the problems early on, which has been shown to work best.
It's interesting that you say things like doing like exercise, meditating, taking care of your body, all of those things that we should be doing anyway are helping people recover from concussions as well.
Yeah, you know, I mean, just like, you know, when one part of your car isn't working, all right, like other parts can have difficulties. I know very little about cars, I know more about the brain, but let's assume your oil is dirty or something. Over time, that's going to cause problems, not just with whatever the oil system is called, but the rest of the engine. All right, you know, eating a diet that's appropriate to keep your blood vessels wide open and to give you energy. You know, typically a vegetarian diet, a low-fat diet, low animal proteins. It's going to be key. Exercising every day, not 3 times a week for half an hour. All right, every day, an hour. All right, and the stairs can be exercised. Walking to work is great. All right, but you know, do something formal. Take a real walk. Go, you know, I'm big in aquatics. Go for a swim, run in the pool, do hot yoga, cold yoga, 3 bags full yoga, whatever you want to do, something where you're actually using your body, all right, every day, all right? And you know, I mentioned meditation. Oh, gotta be mindful, gotta meditate. Whatever gets you for you is fine, all right? Avoid alcohol as much as you can. Red wine may be good for the French, probably doesn't do much after a brain injury, all right? You know, certainly no illegal drugs. Smoking, worst thing in the world for a brain injury and for PTSD. The nicotine's gonna kind of make you more anxious, all right? The tars are gonna slow down recovery. You know, we gotta take as good care of our bodies as we do other, you know, as your lawn and your house and your car and your nails, you know? Instead of manscaping, let's focus on inside your body and really take good care of it. Really important for recovery.
Excellent. The meditation piece, you said that there is evidence-based medicine that shows that meditation helps specifically with concussions, with healing the brain.
Yeah, meditation has been shown to decrease headaches. Meditation has been shown to decrease stress and anxiety. Meditation has been shown to enhance sleep. All right, those are the 3 primary difficulties we have with brain injury. We have pain, usually from headache. We have difficulties with sleep, and poor sleep can cause all the symptoms that we see in brain injury, PTSD, depression. All of those will get magnified by poor sleep.
Yeah.
All right, and also your level of stress, your level of anxiety, your level of worry, your level of irritability are all burners that are going to make your brain worse. Some of them are brought on by the brain injury itself. Those are pretty common symptoms. Some are brought on by the stress of the accident or your life changes. Some are just inherently who you are, all right? And that's terrific, but meditation can enhance that. So when you improve these 3 things, your thinking skills are going to get better. Your memory is going to be enhanced. Your energy level, chronic fatigue syndrome, all right, looks like the things we've been talking about. Meditation can help with that. So, you know, clearly, you know, allowing your body to have that active rest, which is what meditation is, mindfulness, you know, is vital. It's not sleeping. It's not, you know, it's not kind of zoning out playing video games. It's an active process of really letting your brain kind of lose all of those, some of the worldly things that are causing difficulties and stress.
How much time do you recommend every day meditating?
Everybody's unique into themselves, and you should always seek your professional. But you know, if I meditate more than 15 minutes, I usually fall asleep. So 15 minutes is my max. All right. Some people need to meditate for 23 hours. You know, but you know, again, we take great care of other things in our life. Why not your brain and your body? So an hour of exercise. Let's say no less than 15 minutes. I mean, I'd like to say more than that, but I don't want to compromise on the physical, because you can actually meditate while running.
Sure.
You can meditate while swimming. You can meditate while doing your weightlifting. So you can combine that. You can meditate for bits and pieces while you're in your office. Hopefully not while you're watching this or you're on the phone with something important, but don't do it while driving. But you can certainly meditate in between, and that's probably the best type, because most of us aren't going to spend half an hour every day of meditation time, but probably we should. All right, but if we can do it interspersed, that's perhaps a way to kind of combine that.
Okay. That sounds like the flow state of mind. Are you familiar with that?
I'm not, but I'm loving it. Yeah, okay. I mean, I get it. You know,
like while you're swimming or biking.
Right. Oh, yeah. Well, and actually, the endorphins, the epinephrines that are released while you're swimming are supporting that feeling. It's easier to do meditation when you're not focused on the stresses of the world or some little paper in front of you, but really when your entire body is released and your mind is free. And if you do that, exercise becomes more fun. It becomes easier to do because before you know it, 30 minutes are gone by. You've done whatever laps or weights you've done, and your mind is clear.
It's enjoyable.
And if it's not enjoyable, you're not going to do it.
Right.
You know, if you're running because I'm telling you to run, or because you're biking because you've got some race coming up, that's great. It's it's all good. Your body doesn't actually know why you're doing it, but it's ideal to come up with a type of exercise long term that you can really be able to sustain. And it can change, but one where you just feel at peace when you're doing it. So meditating with it or combining it is great.
Great. We have a comment, not a question. We have Donna wanted to say thank you for saving her niece's life 20 years ago.
Don't know who you are, Donna, but right back. My pleasure. I'm sure I know who you are. It's great. It's nice.
Yeah,
it's nice.
We have
She's
another
doing well.
question. Okay. Okay. So we have a comment that says after they were seen at MCV, they were told brain rest, no screen time, no computer, TV. That differs from what you were saying. Is computer and TV okay?
Yeah, so the answer is brain rest is really not the appropriate treatment for anyone. All right, now you could use the term relative rest, but even that, I don't want to. Americans like to rest. We're really good at resting. We have billions of ways of resting. All right, our brain really doesn't need to rest after a concussion. What it needs to do is get back to normalcy. If you sprain your ankle, resting your ankle is actually doesn't ever make your ankle feel well. For the first couple minutes, you stay off it, maybe overnight, you ice it, whatever that does, and then you get active the next day. Maybe you put a brace on it, maybe you wrap it, but you activate it. So the brain needs to be activated the next day by getting into a normal routine. All right, so that's number one. Number two is video gaming and even television, because of the rapidity of the way screens are working, can cause worsened headache because your eyes are trying to track the screen, which normally would happen fine if your brain was healthy. But eye tracking can be off, can be slightly slowed down for the first couple days or a little bit longer after brain injury. So it can make you dizzier. It can cause a worsened headache. It isn't inherently bad for you, but if you're noticing symptoms while watching television, then it's not a positive thing. What I would say is, I'm happy to say black and white, don't watch TV or play video games for 7 days after a brain injury. You know why? It's a complete waste of your time anyway.
Use that time to
go
exercise.
Go read a book, go exercise, go meditate,
yeah.
Go volunteer at a nursing home, to do something, take care of a pet, do something productive, all right? So, yeah, MCV was great, or VCU health system was great when they said that, do it, because it really isn't that worthwhile. Other than some really cool shows on Netflix once in a while, there's nothing out there to watch. All right, so take that time and be productive. All right, do a hobby. But the real answer is, it's most likely best for the first 72 hours to avoid things where you're just staring at a screen repeatedly. All right, without taking significant breaks, particularly if you're having headaches or dizziness, because those are likely being manifest or made worse by that screen that's in front of you. All right. If you need to do it for your work or for school, don't say I said not to do it. Try to do it. Take some breaks if you need to, all right? Or find another role in school or work that you could be doing during that time. But staying home is not right, and doing mindless things, that don't entail physical activity and getting out of your home are really not are going to help your brain. So whatever you need to do to activate is important. Physical activity is always good after brain injury, a mild brain injury, all right? Mindfulness, meditation, always good, all right? Returning to normal patterns or routines, going to work, getting on the school bus, cleaning your house if that's your routine, doing it is always the right answer, all right? Whereas being in an alien situation, dark room, taking lots of naps, never a good idea, all right? Never a good idea. Sleep at nighttime. Until you get to be 75, when napping is actually probably good for the body, let's not be doing these naps after a brain injury. Not therapeutic for you.
Yeah, and it sounded like you were saying, if playing video games, watching TV is, you feel like, hurting your brain or slowing down your recovery, don't do it. Just
Absolutely.
listen to yourself. Meditation, I'm sure, can help with that, being more self-aware of what feels good and what doesn't.
Absolutely, yeah. I mean, there isn't a specialist who can look inside your brain after a concussion and tell you exactly what's perfect.
Right.
There are specialists that can talk to you and can monitor you and can work with you to figure out what's best.
Work together.
So we certainly need your input, but if you have fears and you have ideas about what's good and bad, let the specialist know. If the specialist doesn't know, then explore the answer. All right, but sometimes you're doing things because you heard it on some talk show or you read it in some magazine is interesting, but is not going to be great for you. And we don't need to go to specialized potions and hyperbaric chambers and somebody's clinic somewhere in some other faraway city. Those things don't work. All right, what works is the things we've been talking about, really standard approaches.
Yeah, so I have a question here. How can we optimize our brain health every day? And I think we pretty much covered that. Yeah.
Yes.
Exercise, meditate, take good care of yourself.
Spend less time watching these Facebook things and more time exercising, doing your work. No, this
Right.
is stimulating.
So we're
I'm trying to bounce around a lot and stimulate you, so that's important.
We are close to wrapping up. We've got a few more questions, and then you can go out and exercise and meditate and do all that stuff. Douglas, I think, asked, is it true that your younger brother is smarter and more successful than you? From Douglas.
Well, that's probably my.
I should probably read
Douglas.
my questions before I say them out loud.
And I'm going to take care of his hockey team right after this. So Douglas, so I'm gonna. If you're not nice to me, I'm not gonna take good care of your player. So yeah, my younger brother Doug is brilliant.
Thanks for
Sexy,
watching, Doug.
brilliant. He's a man among men. Yeah, I genuflect.
All right, so we've got, you were talking about 75-year-olds, and we've got a question from a 75-year-old who says, what would you suggest for a 75-year-old who had a severe TBI for exercise? It says he has short-term memory issues and is very hard to get motivated. Before you answer it, this is educational purposes, but I would love to hear how you feel about that.
Yeah, my first love and the reason I got into the field of rehab was for geriatric rehabilitation. And, geriatric rehabilitation is an area that has suffered because we believe that rest is important and doing things, kind of having things is always the solution. The answer is, 75 is just a number, all right? And so we have to figure out, what kind of a 75-year-old are we talking about? We're talking about a person who has a lot of physical energy and was used to that. Person, it sounds like you or the individual speaking up is having some thinking changes. Was that the way it was before the brain injury? If it was a severe one, likely the brain injury has caused some of those, all right? And we do know that physical activity, an hour a day of aerobic activity has been shown to improve thinking skills after brain injury, as well as to enhance recovery after depression. So physical activity, aerobic activity, particularly walking, all right, walking in the water, walking on a treadmill, whatever, has been shown to enhance thinking recovery. So the answer is, whatever we can do to get this older adult to be more physically active or independent is important. Could be at a wheelchair level, could be in a pool, could be walking, could be something, could be tennis, could be something advanced as well. That's one piece. A key to older adult recovery and even younger adults is social engagement. Social isolation is the kiss of death for someone who's had a disability, for someone who's somewhat older. So getting involved with the community, with your friends, with a social club, with a men's club, a women's club, an Italian club, a bingo club, whatever club you can get in there. Doing volunteer work if you can. I know it sounds weird that you'd be volunteering when you're not doing well, but there are often folks that are in an institution that would love a visit from someone from one of their peers to talk about stories. Work at the VA, work at VCU. So getting socially engaged, getting physically active, keeping cognitively stimulated, traditional crossword puzzles, reading the newspaper, watching some important key television like the History Channel or maybe some cutting edge news channels, not the generic stuff, reading books. All right, but the key is, how do we integrate back into our lives? Because we are social animals. Our brain works best when there's multiple activities going on, and it works best with another human being. Another substitute is animals. If you can't go out all the time, a pet is wonderful. Dogs, cats are ideal. Not high maintenance animals. Birds can be challenging. fish are okay, but anything is really important, you know. And then make sure you're seeing your primary care doctor and optimizing your cardiac health, your blood sugar. Make sure your bones are healthy, because if you have a brain injury, you're at risk for falls. We don't want to get a stress fracture or a compression fracture of the spine that could make you worse. So always be looking at the whole body. Always be looking outward, how to integrate with the community and our loved ones. Always making sure that we're doing the simple things. Again, meditation, good diet, simple exercise, seeing our primary care doctor at VCU, and making sure we're preventing a second injury, making sure the fall risks are decreasing.
So when you say physical activity, you're not saying everybody has to go out and do CrossFit and run sprints. Yeah. You're saying physical activity could be as simple as going out on a walk, or, you know, just doing simple things.
Anything that's more than what I'm doing right now is optimal. You know, actually for an older adult, just going from sit to stand repeatedly, not using your hands, all right, would be a weight exercise. Yeah. You know, doing simple leg kicks here, doing bicycling while you're sitting down, taking a walk inside a home or outside. You know, being part of a an aquatics program where you jump around a little bit. You know, clearly, the more you can do, the more advanced we want to be in terms of looking at our heart rate, making sure we're getting that up right. We want to make sure we're monitoring our blood pressure. We want to make sure we're monitoring our temperature, etc. But you know, the chance of you hurting yourself by doing simple walking exercise is about 1 out of every 750,000 patients that does that. Yeah. That's a really low risk. Yeah. Your risk of getting fat, of getting heart disease, of getting diabetes by sitting on your butt, it's like 1 in 5. So I'm pretty sure we can do a little bit of walking. But again, if in doubt, talk to your clinician, you know, talk to your healthcare provider and kind of get a move on.
Perfect.
Including my brother Douglas. Move.
And I promised we would talk about this this grant that you're working on. We're definitely running out of time, so here's the biggest challenge. Can you sum up the $62 million grant in maybe like a few minutes? Yeah. Tell us what your updates are. Yeah. So in 2013, after about 3 years of planning, the federal government released $62 million to fund a center of excellence that would establish a nationwide consortium to study the short and the long-term effects of combat concussions on veterans and service members. Right? Now, the vision was a concussion's a concussion's a concussion. So whatever we learn from studying folks both in the military theater as well as once they come back to the States when they're veterans and how they do, that information would be vital to civilians, whether they be in car accidents, whether they be having falls or being sports, all right? So it isn't just about veterans and service members, but that was where the funding was from, that was the captive audience, and it was certainly during the conflict. So 2013, VCU gets this, the largest grant in VCU history, gets this grant to essentially set up this nationwide system. We currently have 30 universities, 15 VAs, and 7 military treatment facilities across the U.S. That are working together on 10 large research projects looking at individuals that have had concussions. And the individuals we're studying have either had a combat-related concussion or were in combat and didn't have a concussion so they could serve as a control. Just about all of these folks have also had a second type concussion when they were civilians, before or after the conflict, or even in the military that was unrelated to combat. So while we are studying combat injuries, the vast majority of the folks that have had brain injuries have also had a second or a third from another source. So we're actually studying multiple injuries, we're studying combat and non-combat, and we're looking at them both in the relatively acute phase. But 3 months and a year is kind of when they're getting enrolled in the program. We did have one study that we're just finishing up now where we had 500 folks who were injured in Iraq, and we studied them there, and now we're following up 3 to 7 years later, so we're going to see the results of those folks. But what we're doing is we're evaluating how folks are doing with this snapshot in time, so we're about a year out, how they're doing every year after that, and then how they're going to be doing long term. We've only had our study up and running 3 years, but we've recruited about 800 subjects so far. We're going to try to get over 2,000, and then we're going to be studying them annually for 5 years, 20 years, 50 years to see which folks get better, what kinds of treatments seem to work best, what factors will make them worse over time, what things, the stress, depression, pain, what things are combined and give them the most difficulty. And then who is that small group of folks that go on to really get worse, whether it's full-blown dementia or just worsening symptoms.
Is there a genetic issue? Is there something in the environment? Is it something they're doing, not exercising? Is it a medicine they are or they aren't taking? Is it who they are? You know, what their race is, what their gender is, what their age was. So those are the factors that we're just bringing together now. And we're about halfway done with all of our subject collection. All right, and so in the next 2 years, we're going to finish all of our subject collection. Then we're hoping to get another 5 to, let's make 50 years of funding to keep studying this, just like the Framingham study did for heart disease. We are the brain study. But we're also linked to about 4 other large NIH and Department of Defense studies that are studying brain injury. So we're pooling all of these data together.
Yeah.
So that's what we're in the process of. And if you want to check out more, look at cenc.rti.org, which is our website, or you can link through it through VCU.
Yeah, and we'll be sure to add a link to that website on our comments section. I think we are coming up on 1 hour, so I appreciate you talking with us about concussions. Thank you for watching, and our next VCU Health Chat will be in about a month. Stay tuned on the VCU Health Facebook page for more information about that. Thanks.
Thank you.